Good morning. Welcome.
Hi, thank you for having me.
Thanks for coming. I'm Dr. Natasha Diaz. This is Christy Gupton with Custom Benefit Solutions. And I'm just going to do a brief intro. We know that small business owners are struggling to provide affordable health care and that it's one of the largest expenses for businesses today. And we've met employers who provide health insurance plans to their employees that don't really meet the needs of the company or the healthcare needs of the employees. And we're here to talk today a little bit about the choices most employers didn't know they had. And I start by explaining that health insurance does not equal healthcare, and that there are savvy business owners finding ways to structure healthcare benefits now that improve the quality of care for their employees while lowering the cost of that line item expense. And with traditional plans, a lot of employers have found that their employees might opt out because their premiums are too high. Or if they do opt in, they still cannot access the care they need because they have an inability to meet the deductibles, the copays, or they can't get access to the doc they need. And so when these things happen, we know it affects the productivity of your business. And commonly, most employers have resigned themselves to accept this as the norm. And so we're here to kind of mix that up. And we know that the success of your business depends upon the health of your workforce. And we know that employers want to provide healthcare for employees at a cost the business can afford. And today that benefits landscape is changing. So by staying up to date with these changes that ultimately affect your bottom line, you can propel your business ahead of the curve so that you can recruit and retain the best talent. And today, we're so grateful to be joined by Christy Gupton, a nationally recognized employee benefits advisor. She's highly sought after for her thought leadership and ability to bring transparency into the healthcare industrial complex that so many employers struggle with today. Shaking up the status quo, reimagining healthcare for employee populations with the inevitable outcome of saving millions of dollars for the employers who entrust their plans to her oversight. Christy places direct primary care at the center of all her benefits plans, recognizing the value DPC provides with both higher quality and lower downstream healthcare spending. Christy says, all it takes is a good advisor and a little bit of courage. Christy, welcome.
Thank you so much. I really appreciate being able to share some thoughts with your audience today. So let's do it.
Thanks. Yeah, so we're going to talk a little bit about the ICHRA, ICHRA, that vehicle, and how you're utilizing it with direct primary care and what your four-pillar approach is. So if you can talk to us a little bit about how the ICHRA works, that'd be great.
Sure. So, ICHRA, let's just say what that stands for right off. It stands for Individual Coverage Health Reimbursement Arrangement. And health reimbursement arrangements have been around for a long time. As a matter of fact, they date back to the Family and Medical Leave Act of 1993. And so it's not new. However, uh, they sort of morphed during the Obama administration into allowing insurance to be reimbursed through an HRA. And that version was called the Qualified Small Employer HRA, and people referred to that as ICHRA. Oh man, do we ever love our acronyms in this industry, right? And then in the Trump administration, they expanded the ICHRA, renamed it ICHRA, Individual Coverage HRA, and it was no longer just for small businesses. It was really for any employer, no matter the size. So I have a couple of clients utilizing this vehicle. The smallest one I have right now is 4 employees, and the largest one is around 60. So I think it's something that needs to be talked about more. A lot of brokers may not want to touch on this subject because it monkeys with their bonus structures, with Blue Cross or some of the big insurance carriers. But I truly think it's a great option, especially for the employer that says, you know what, I don't want to be in the insurance business anymore. I want to focus on what my company does and let employees pick how they want to structure their health coverage. And so if employees like direct primary care and The health share that I like is Sedera. If they like that combination, then fine. I'm going to give them some money to go out and purchase that with. And when you add the ICHRA to a benefit strategy, it allows the employer to check the box on the employer mandate, so they get themselves out of penalty territory. And it allows them to offer employees a way to use their own pre-tax dollars to contribute to their healthcare strategy through a flexible spending account too. So that's where I come up with my 4 pillars of smart healthcare strategy, especially for the employers who just don't want to be in the insurance business anymore. There's nothing wrong. There's definitely nothing wrong with employers who have a self-funded health plan and it is rocking and rolling and everyone loves it. Nothing wrong with sticking with that strategy. But there are definitely employers out there who haven't had a good advisor quite yet and a little courage to try something new. And so if it's time to just call it a day and say, you know what, we tried having a group plan and it's not working out so well for us. And now, at least for a while, we're going to try this method. We're going to give employees money, let them shop on the individual marketplace if that's what they feel they need, or let them spend money on direct primary care and something like a health share for their catastrophic care. So I like it. I just think it offers options that no one really is talking about. And also, as a third-party administrator, I'm at least registered as a TPA in the Carolinas, and getting that set up in other states is just a matter of paperwork. So it can easily be duplicated in all 50 states.
Yeah, so let's dive a little more into ICHRA, because I understand it to be like a form of subtype of an HRA. And that right. It's pre-tax dollars from the employer that the employer will determine where those dollars can be spent, whether they'll be reimbursed for healthcare expenditures, things like DPC memberships, but also medications, specialty visits, any imaging, x-rays, those kind of things, right? So together with the direct primary care doctor sort of navigating the low cost, high quality options, you can really get pretty far with those dollars in the healthcare world.
Yeah, you sure can. Yes, since health reimbursement arrangements are a type of self-funded employer-sponsored health plan, they have their own plan document. So that plan document can be custom designed. If it's an ICHRA, then it certainly needs to include reimbursement for coverage bought on the individual marketplace in each state. But outside of that, all of the types of out-of-pocket expenses that people might refer to as Section 213D expenses, all those kinds of like co-pays, deductibles, or the cash price for prescriptions or whatever if you're paying cash. HRAs can be set up specifically designed to handle those expenses as so far as the money will last. So yes, choosing a direct primary care doctor to be sort of like your Sherpa, in the healthcare system. Employees who choose that route are always going to spend less of those HRA dollars and have more of them left over, at the end of the plan year. And the employer has discretion on what they do with the leftover money. They can recycle it for the good of the whole. They can reinvest it into the business, or they can recycle it into the next plan year for each individual employee. So let's say you and I both work at the same employer, and you chose a DPC doctor and Sedera, and you spent less of the HRA dollars that you were allocated for. But I spent all and then some, because maybe I chose the individual coverage route on the marketplace, and I had, high deductibles and all that. And so the price points are always set higher on that end of the spectrum. You had money left over. I didn't. If the employer chooses to roll over those unused funds specifically as how they were allocated to each individual employee, then you've got money to roll into next year and I don't. So there's all kinds of different ways to do this. It brings a lot of creativity to the employer where maybe they didn't have those options before. And I think it promotes a lot of healthy, savvy, consumerism, where maybe before employer-sponsored insurance was just seen as a blank check, which is the wrong way to look at it.
Yeah, that's great. And so it sounds like there's a lot of flexibility for the employer and the employees in this system to be able to utilize those healthcare dollars if they choose to through the traditional system, but also if they choose to through the direct primary care, where there is a lot of cost savings. And if you have a really good direct primary care doctor, is going to be a steward for you, right? Navigating the healthcare system, not just financially, but also, as an advocate for you. So I think those are really, important points. And I know, the four prongs to your approach were the direct primary care, the ICHRA, which is the employer side, the FSA, which we all know about, is the employee side for healthcare spending. But then the last part was the health share plan. And of course, we could do a whole show on health share planning. But can you kind of just put in a nutshell, what is your experience with health share plans, and what are the options that employers have for patients who maybe wouldn't qualify for health share plans, employees, right?
Sure. I can really speak to this because I took about a year between 2019 and 2020 to vet all of the health shares I could get my hands on. I talked to many of them. I listened to their sales pitches. I talked to their executives. I read their filing documents. A lot of them are, structured as nonprofits. So I looked at their 990s. It was a big project. And I needed to do that because at the time I was on my husband's health insurance, big Blue Cross of North Carolina plan, through his employer. And I wanted to make sure I was making the right move, because I too am a person with pre-existing conditions. I needed to make sure that I wasn't making a bad choice. So, but I really wanted direct primary care. And so that was the motivation behind this year-long project, because I wanted out of the typical insurance nonsense. I remember about like the month or two before we made this switch, it must have just been, cold and flu season plus a couple of other things that ended up putting us, one or more family members in urgent care 4 times in 1 month. And that upset me so much, because I was just like, good grief, at $75 copay a pop for an urgent care visit, I could have paid for 6 months, maybe of direct primary care. So I knew I wanted it bad, but I needed to make a good decision. So after that vetting process, I did choose Sedera. That checked a lot of boxes for me. I wanted to make sure that they had the right mechanisms in place to hold the community's money. I wanted to make sure they negotiated provider bills, down to a fair market price, Medicare plus some small-ish margin. I wanted to make sure they understood and really valued direct primary care. And there's a long list of things that I checked over. Ultimately, to the best of my knowledge today, employers can use health sharing with 2 different companies, Sedera and Zion Health. And I prefer Sedera for a lot of different reasons, some of which I've already mentioned. So there's an employer platform where you can offer Sedera as a benefit. And since it's not insurance, employers can pay nothing towards it if they can't, or they can pay 100% of the Sedera, or anywhere in between. They have a lot of choices, a lot of flexibility, because since it's not insurance, and it really, as long as you have 5 employees that want to do it, then you've got a group plan. And if you don't have 5, then there's an individual route you can go. So it's in my opinion, it's the way to do it.
Yeah, and then a little bit for the employees who are maybe not going to qualify, how would you speak to that for employers? Because, first of all, there are some who may not understand direct primary care right away.
That's right.
And again, I think that speaks to the employer and having your direct primary care doctor involved in the discussion with the health benefits advisor to make sure that your employees truly understand the value that direct primary care does bring to the table and the benefit of being able to call your doctor, text your doctor when you're sick and not have to wait in line to be seen at an office that might not be able to see you for a week. But also just kind of the flexibility that some patients are not going to want that option. They're going to want traditional insurance. And this allows employers to still be able to offer that to to the employees that choose that.
That's correct. So, I get this a lot. You mean I have to change doctors? No, you don't. You don't have to change doctors. You have the option to go to the marketplace and try to, as best as you can with the money that you're being given in this ICHRA, to duplicate your current plan on the individual marketplace. And there are thousands of plans to choose from. Even if there's only one carrier, there's lots of different options inside, with different deductibles, copays, and different networks and things like that. So each state's exchange is a little bit different, but within that, there are a lot of different options. So you're not being forced into something that's not a good idea for you. And if you have pre-existing conditions that are serious, my pre-existing conditions that I have were all related to chronic disease, so what I really needed was a great doctor who could see me, anytime I needed and still work closely with me because they have time on their hands. That's not something that most people get in the fee-for-service system. They don't, they usually get 10 minutes or less with a doctor. In direct primary care, there's almost unlimited time. So that's what I knew I needed. But if someone is dealing with something serious, maybe they take a very expensive specialty medication, or they're in active, oncology, or they've got a really big surgery they've already been approved for that's coming up, that's what the individual marketplace is for. Let's face it, we already pay taxes that go to these carriers so that they have the money to accept all of this risk.
Right. And those employees also have the option, even if they use the traditional system, to use the FSA funds for a DPC membership. So it's not that they're being excluded. They always have the option to get the high quality one-to-one, kind of unlimited time care that is necessary, especially to care for those types of conditions. So it's just I think it gives the employers and the employees the flexibility to choose, right, what works best for them, and to change from year to year if they choose to do so, right? I mean, depending on their condition. And so I think it's an awesome thing to just know. I think knowledge is power, and that for me anyway, making sure that employers have the option to run their business in a way that's productive for their business, that this obviously is one of the biggest ticket items that affects the bottom line, and employers really need options to be able to serve the employees with excellent healthcare services that then return back to them because their employees are healthy, their productivity increases, their ability to recruit and retain increases. They really are small business owners. They represent the American dream. So the more we can do to educate and give information on the options available for healthcare benefits for employees that are better than what's out there, the better. And from me to you, just to see that, you are really walking the walk. You actually, drink the product, right? Like you are taking the medicine yourself, right? You are not just selling it. And so for me, that's huge when you find a benefits advisor who's actually utilizing direct primary care and understands the value that's there. So thank you really just so much for joining us and talking today about ICHRA and your four-pronged approach. And I did just want to say, Christy, that, if anyone's interested in learning more about the service that your company Custom Benefit Solution provides, how can they reach out to you?
Go to my website, www.custombenefits.work. hook up with me on LinkedIn. I'm always posting stuff out there, and I'm sure that we'll get connected that way, and then we can continue the conversation. I recorded a webinar about that four-pronged approach. It's on my YouTube channel. It should be public. So if you navigate there and find me on YouTube, you can access that video, or if you can't find it, I'll just send you the link.
Yeah, I'll link to it in the notes. Okay.
Okay, super.
Perfect. Thank you so much for your time today. I appreciate you joining us.
Thank you for yours too. I appreciate being invited.